Hi, welcome to Health Matters. I'm Rosie Smith, your hostess for today's show. We're here on location at Dr. Robin Albritton's office with Chipola Surgical and Medical Specialties Family Practice. Joining me today is annual wellness visit nurse Jesse Roberts. Jesse, welcome to the show.
Hey, it's great to be here.
Thanks for letting us come in during your practice day.
Absolutely.
All right, well, tell us a little bit about how you got into nursing.
We had a counselor come by the high school when I was in 10th grade, asked everybody what they wanted to do. I said I wanted to be a nurse. I went from there. I graduated, started at Chipola, went into nursing school there, graduated, did the BSN program at Chipola.
Excellent. And here you are.
And here I am. Yeah, started in medicine as a orderly at Jackson Hospital at 19, 20 years old, and progressed from there. I love everything about nursing.
And you're only 22 today, right?
Yeah, you're right. Yeah, absolutely.
Now, are you from Marianna or the surrounding area?
Yeah, so most of my family is from here. Actually went to high school in Tallahassee, but came back to this area. My wife is from here.
Well, wonderful. We're glad you're back and here
absolutely.
with your people. And here at Jackson Hospital, of course, the Chipola Surgical Medical Specialty practices, whether it is primary care or the specialties, are a practice of Jackson Hospital. So it allows you to have definitely a dimension to your career.
Yeah, for sure.
So what are you thinking about the annual wellness visits? Why is that important for our viewers to be introduced to this new concept?
Well, I hadn't heard of it either. When I was sort of approached about doing this, I had to research it myself. Mm-hmm. There's not a whole lot of information out there, and in fact, nationwide, there's only about less than 20% of doctors that are participating in annual wellness. At Jackson Hospital, we wanted to be some of the first that were participating in it. An annual wellness visit is not the short sort of quick doctor visit in and out. We take our time with our patients. We allow them to talk to us about anything they would like, medications. We do a lot of education and opportunities. Mm-hmm. It's amazing to me is people are on medicines for years and they had no idea what it was for. So we talk about that. In an annual wellness visit, we'll do some screenings, some basic screenings to determine if you're having any problems, if you're having recent falls, if you're having depression. A lot of these things affect our Medicare patients, and so we want to make sure that they're getting an opportunity to share those things and that we're screening for them. So the majority of these annual wellness visits are going to discuss screening and preventative health measures. What can we do to early detect problems, and then what can we do to fix those problems now? Everything in medicine is headed towards preventative medicine.
Right.
And that's part of this. It's a continuation, and it's continuity of care. You're coming into your physician's office. You're seeing one of his nurses. They already know your history. We also ensure during these visits that we're getting all of your records. If you're seeing any other specialist, there are times I may have a patient that sees 3 or 4 different specialists. Unfortunately, records aren't always good about coming through. A doctor at another office may not send them. It may not end up in your chart for some reason. So we ensure at these visits that if you're seeing other specialists, I have those documents. There's good communication between your doctors. And it really ensures that nothing is sliding between the cracks. Nothing is getting missed on you. It's important for our physicians and our patients to know that everything is being done that needs to be done for you, and we're not missing anything. So
that is a wonderful community
service. It really is a great program.
It's kind of like the tie that binds.
Yeah,
make sure
absolutely.
Everything comes together.
And there's no copay for an annual wellness visit.
Well, that makes it even more attractive,
it does.
too, because I know seniors worry about money and enough resources to go around.
Yeah, absolutely. And we do that as well. We provide a list of resources in the state of Florida that may be able to help if any of my patients are having difficulty. We provide numbers for Meals on Wheels. Mm-hmm. I've followed up after hours with looking to see if there's what can I do to help this patient who's having this issue.
Kind of the social service aspect.
Absolutely. It blew my mind how many needs there really are out there for our patients. And so I talk very closely with your physicians and try to figure out what can we do to solve this problem, some of which they didn't even know you were having until we had these visits, and I got to talking to them and discovered some issues like that. So they're Very valuable visits. And I really enjoy it too. I meet a lot of great folks. I listen to a lot of their history. I have patients I had a patient in World War II. And
Wow.
I mean, it's phenomenal to listen to some of that history.
Well, that's really neat. So the annual wellness visit, you kind of gave us a really nice description about it, but which insurers pay for an annual wellness visit without having a co-payer
So
deductible?
all Medicare, traditional Medicare, and all HMO Medicares. If you have United Medicare, Blue Cross Medicare, if you have an AARP Medicare, something like that, all your HMOs cover it too. These are all
Right.
covered. One of the things that we have found doing this is that some of the HMO insurances, they want to get in on helping you as well to do these annual wellness visits.
Sure.
So they are calling and sending people to the home to do the annual wellness visit. While that is completely your choice to do, we really prefer that we do them at your physician's office.
Where you see your doctor
Where
regularly.
you see your doctor regularly, because then there's no delay in information. If you need something, we know it immediately. We know at that visit. I can leave the visit and go discuss with your physician, hey, this is going on, and sometimes that need is there to do. So coming to your doctor's office is a place you're comfortable with people you know, with a physician who's there. It's much better continuity of care in that sense. So we encourage our patients to, if they haven't had an annual wellness visit, to contact their physician, ask about it. We'll check and see if you're eligible for those, if you've had one, and if you haven't, and we'll schedule it. And it's great. We can come talk and meet and go over a few things in your healthcare in the meantime.
All right, and that applies. The annual wellness visit is not just specific to this practice. It's available to all primary care physicians.
Yes, absolutely. I think one of the reasons nationwide it's being missed or not being done very much is because these visits are meant to take longer. They are meant to get to know our patients. It's an opportunity for us to get to know our patients on a much better level. And the patient can not just talk about the cough or the cold they've had or the medical problems they've had, but they can talk about anything they want to. And as those needs arise, we can do anything within our power to try to meet them. Is there an agency there that can try to meet those needs? Is there something that help you're needing at home? Can we try to, is physical therapy something you may need? Can we go ahead and get home health in? And we do that on many of our patients. So, it's a longer visit, and I think that's why some physicians aren't doing it. But yeah, absolutely, all of our physicians, I travel to all of our practices
From here to Sneeds,
from
right?
here to
back.
Sneeds, absolutely. And get to meet a lot of great people and get to do a lot of good. In fact, in these screenings we've actually discovered 2 early cancers.
Wow.
And doing the screenings. So in a screening maybe you haven't gotten or didn't know was available to you, and we order the screening and it comes back, and these are early, and so they're going to be treatable, and the patient should.
Lifesavers.
Absolutely.
Wow, that's phenomenal.
Yeah, it really is. It makes a big difference.
Well, the concept of the annual wellness visit is a little different than what we typically think of physician visits, viewers. I mean, usually, you're sick or you've got something that popped up, you broke your ankle, or, it's very specific typically. Right. And so this whole annual wellness visit sounds like a kind of a earth-shattering new concept where I'm actually coming in to talk to you about all aspects of my health.
That's exactly what it is. So there's no... normally when you come in, like you said, you're sick, you're talking about one specific event. When you come into us, you're not. You're coming in, with health problems, but healthy. So we get to talk about all the other things that you may not usually have time to talk about or even think about because you're there for one specific reason. With us, we do a lot of different screenings. We look at your nutrition. We do a visual acuity exam. We do a depression screen. It was really amazing to me to learn how many of our patients are struggling with depression. And it's one of those things that we don't talk about very much. These visits allow you to kind of, talk about things and open up about things if you want to that you're having needs for, and we screen for that type of thing. So that way, if there's something that we can do, if there's something your physician can do, we're going to do it for you. So it's an important visit that I hope all of our viewers are able to at some point get.
Absolutely, and they need to be talking to their primary care physicians and setting this up.
Yeah, absolutely.
Obviously, the Centers for Medicare and Medicaid really feel like this is important because they provide the benefit without a deductible or copay.
Yeah, absolutely. Well, and a lot of this is too, like I say, medicine is headed towards preventative health. So if we can prevent something, if we can pick up, we do one of the things that people always remember about these visits is we do a very brief, very simple dementia and Alzheimer's screening. If people remember nothing else, they almost always remember the memory screening that we do. But it's important. If we can pick up on minute changes like that, there's better evidence to support that if we can start treating things, the earlier we can start treating them, the better off that the patient outcome will be.
Especially since people are living so much longer, you want all those years that you have additionally now because of good health and modern medicine to certainly be as healthy as for as long as possible.
Yeah, absolutely. We want to catch things in early stages, and so that's part of what this does with the screenings. When you come to us, when you leave, let me mention this. When you leave, we give you a personalized prevention plan. This plan is going to go over education specific to your health illnesses. It's going to go over a plan of screenings that we can order if you need them or want them. And let me clarify that it's all optional. We tell you what's available to you. If you don't want to get it, that's up to you. We encourage you to do your screenings, but we leave you with that education. We leave you with your personalized plan just for you
chart.
as well. Absolutely. Before the patient ever comes in, we've already been through your chart. We've already looked at your illnesses. We've already printed out education pertaining to you, and we go over that with you as well. So they're really invaluable.
Yeah, it's
visits.
a nice service.
Yeah.
And so our viewers might be wondering, is this something that I only get to do once, or do I get to do it only if I haven't seen the doctor before in the year? Like, what is the timing and the sequencing of my regular doctor visits?
Yeah, that's a good question. All right, so initially, a patient new to Medicare will do a welcome to Medicare visit.
Okay.
We review those screenings. It's like an initial annual wellness visit. There's a little more to it. There's a little more of a physical aspect to that.
Kind of like a baseline of where I am.
Absolutely. And then the next year you'll have an annual wellness visit, and then you will have subsequent annual wellness visits every year after that. If we can pick up on a change from this year to this year in some of the screenings that we do, that's what we're trying to accomplish. And there also may be preventative things that you may not qualify for this year, but now all of a sudden you have this problem going on and you qualify for the next year. So we do these, absolutely. Every year you come in, we keep up with that. I'll call you about 2 weeks before that appointment, make sure it's a good time for you, and we'll come in. It's great to see the patients too, see how they're doing from year to year. We have a lot of patients in this area. It surprised me that have really lived an extended period of time. It's not uncommon for me to see 85, 86, 87-year-old patients, and some of them are doing phenomenal, and we want to keep it that way,
Absolutely. I get all the goodie out of life.
I tell them I'm going to see you next year. They say I hope so, and I say I believe I will. You're doing fantastic, and with some of these screenings and things, hopefully we catch any problems.
Right, because 65, which is the typical age for Medicare, right, to enroll in Medicare, that used to be seen as a really old age. Well, 65 now is like the new 45.
Absolutely.
So, there's a lot of people that are of Medicare age, but they look so much younger and they're still very active working.
Absolutely.
They have another 35 to 40 years ahead of them, really.
I have patients in their 70s that go to work every day.
Yeah.
And they're doing wonderful. And
so let's do it healthily, right?
So let's do it while you're healthy. And that's the key to these visits. Let's do it while we're not having problems to try to get these screenings, prevent problems from happening, prevent extended acute treatments, long-term hospital stays. That's what we want to do. We want to keep you out of long-term hospital stays and keep you treated in early stages of problems. And so far, that's what we've been able to accomplish. It's really it's made a big impact on patients, and it's made a big impact on me. I'm really shocked at how much I enjoyed doing these visits and speaking with people and learning their history and what they did. And and they're saying, I'm doing pretty good, my back's kind of hurting. I'll say, yeah, well, you worked for 50 years and you did this and this. So if it's hurting, I want you to keep in mind it's hurting because you worked hard your whole life. And that's a generation that I don't know that we'll see again. These are hard-working people.
They are, and it's just so heartwarming to hear the richness of our community's lives. I mean, they've made significant contributions all over the world.
Absolutely.
And maybe were reared here and came back home here to retire and enjoy their family and friends.
Yeah, many of them. Many of them are not from here and just recently moved here after retirement, and I hear the same thing over and over again. We love it here.
Yeah.
We love the people here. We love the community here, and we want to extend that to. I love my doctor's office. They care for me deeply, and they want to make sure we're not missing anything and nothing sliding between the cracks. And that's what we're doing. The physicians that are doing these visits understand the importance of ensuring that everything's getting followed up on and things are getting done in a timely manner. And there's a lot going on in the doctor's office, and the doctors that are taking advantage of these annual wellness visits understand the importance of that continuity of care continuing with the annual wellness visit.
Yeah, that's excellent. So if you are a caregiver for somebody who's of a Medicare age, whether they're on the traditional red, white, and blue Medicare, as you said, or the HMO Medicare, make sure that you are enrolling your loved one in for the Welcome to Medicare, which is a one-time when your parent or loved one signs up for Medicare, and then the subsequent annual wellness visits, which are each year forever. So that's a very important part of the health plan and care plan for your loved one. So, and of course, if you are the independent senior, make sure that you are booking these with Jesse or your primary care provider, so that way you can take advantage of this. And as you said, there's no copay and no deductible for these, so really it is something that is really important. It's important enough to make sure that it is fully accessible to everybody.
Absolutely.
So we are all out of time. We are so delighted that you joined us here in Dr. Albritton's office, right here at 4295 3rd Avenue in what I call the medical district of Marianna. And remember, Chipola Surgical Medical Specialties spans from Marianna all the way out to Sneeds and throughout the city. And Jessie is the wellness nurse for the Chipola Surgical Medical Specialties practices, whether it is for Dr. Albritton or for Dr. Krishna, for Abby in Sneeds. And as you can tell, he's just really committed to helping our seniors make sure that they have a really terrific health plan, an airtight health plan for great health as we go along. All of the primary care physicians on staff at Jackson Hospital provide wellness visits, so make sure that you ask for those and get those booked today. We're all out of time. Thanks for watching.
You're watching Chipola College Television.